Approximately 80% of leg amputations in older adults begin with small foot problems that initially seem harmless. Signs such as swelling, numbness, changes in skin color, or unusual sensations are often overlooked, mistakenly thought to be normal signs of aging. However, these could actually be early warning signs of serious conditions such as cardiovascular disease, nerve damage, or complications from diabetes. Since the feet are the farthest point from the heart, issues related to circulation and nerve function often appear there first. Therefore, paying attention to and detecting early abnormalities in the feet not only helps prevent severe complications like gangrene, infections, or amputation, but also serves as an effective way to protect overall health. Older adults and caregivers should pay special attention to even the smallest signs in the feet to promptly detect and treat potential health issues. In this video, we'll reveal 8 foot-related signs that older adults should never ignore. Each sign tells a different story about what might be happening inside your body, but make sure to watch until the end, because the number 1 sign on this list is the most dangerous of all. It may indicate a silent condition that affects millions of older adults. Plus, we'll also share 3 powerful foods that naturally boost blood flow to your legs and feet. These foods are easy to find, delicious, and could potentially save your limbs, or even your life. Before we get started, let us know in the comments below where you're watching from, and don't forget to like this video and subscribe to our channel for more content like this. Now, without further ado, let's dive into the first sign. Consistently cold feet, even when wearing thick socks or staying in a warm environment, are not simply the result of cold weather or aging. This could be an early sign of peripheral artery disease, PAD, a condition in which the arteries supplying blood to the legs become narrowed or blocked due to plaque buildup. When blood flow to the feet is reduced, the body cannot maintain normal temperature, leading to sensations of coldness, numbness, or even a loss of feeling in the feet. PAD not only affects mobility, but also poses serious risks such as foot ulcers, tissue death, gangrene, and even limb amputation if left untreated. One of the simplest and most common methods to detect PAD is by measuring the ankle brachial index, ABI, which compares blood pressure in the ankle to that in the arm to assess circulation levels. If you frequently experience unexplained cold feet, it's important to see a doctor early for proper diagnosis and management of PAD. Unusual hair loss on the legs, especially when it occurs suddenly or is more noticeable on one leg, may be an early warning sign of poor circulation. When the circulatory system is compromised, as in the case of PAD, blood flow to areas far from the heart, like the legs and feet, becomes insufficient. In such situations, the body prioritizes sending blood to vital organs like the heart, brain, and lungs, reducing supply to the skin and hair follicles in the legs. Lacking nutrients and oxygen from the blood, these follicles weaken and hair begins to fall out. A common pattern of hair loss is the sock-like appearance, thinning or loss of hair from the ankle down, often with asymmetry between the legs. Many older adults mistakenly attribute this to normal aging and overlook it, but in reality, it can be a crucial signal that something is wrong with the circulatory system. Paying attention to subtle changes like these can help detect problems early and prevent more serious complications in the future. A tingling or needle-like sensation in the feet is one of the classic signs of diabetic nerve complications, also known as peripheral neuropathy. When blood sugar levels remain elevated over a long period, nerves, especially those in the extremities, such as the feet, can become damaged. Patients often describe the sensation as pins and needles, burning, or even complete numbness in the affected area. Loss of feeling in the feet makes it difficult to notice cuts, burns, or minor injuries. If these wounds are not detected and treated in time, they can become infected and develop into diabetic foot ulcers, a serious complication that may lead to tissue death or even amputation. This condition is especially dangerous because it progresses silently and is often painless in its early stages, causing many to ignore it. Therefore, if you frequently experience tingling, burning, or numbness in your feet, especially if you have diabetes, it is important to get checked early to prevent dangerous complications. Cracked heels that bleed are not merely a cosmetic or dermatological issue, they can be a warning sign of underlying health disorders. This condition is common among older adults and may be related to hypothyroidism, diabetes, or peripheral nerve damage. When the thyroid gland is underactive, hypothyroidism, the body does not produce enough hormones to maintain skin moisture and elasticity, especially in the feet, which bear daily pressure. Additionally, diabetic nerve damage can impair sweat production, causing the skin on the heels to become dry and prone to cracking. When these cracks deepen and begin to bleed, they provide an entry point for bacteria, increasing the risk of serious infections, ulcers, or even tissue necrosis if not treated properly. Therefore, if you notice persistent dryness, cracking, or bleeding from your heels despite moisturizing, consider it a warning sign from your body and seek a medical evaluation to identify any underlying causes. Discoloration and slow growth of toenails are abnormal signs that older adults should not ignore, as they may indicate poor blood circulation. When blood flow to the lower limbs is reduced, the toenails do not receive sufficient oxygen and nutrients needed for healthy growth. As a result, the nails grow more slowly, become brittle, deformed, or change color, often turning yellow, purple, or bluish-gray. Many people mistake this for a fungal infection. However, there is a key difference. If the cause is poor circulation, the symptoms typically appear on both feet and do not respond to standard antifungal treatments. In contrast, fungal infections are usually localized to a few specific nails and tend to improve with proper treatment. Monitoring nail growth speed can also be a helpful indicator. Nails on a foot with impaired circulation grow significantly slower than on the other foot or compared to fingernails. If you notice such persistent changes, consult a doctor for a vascular examination and appropriate treatment. Persistent leg or ankle swelling is another important warning sign that older adults should not overlook. If the swelling does not subside after elevating the legs or resting, it could be an indication of serious conditions such as heart failure, kidney dysfunction, or liver disease. These organs play a vital role in regulating fluid balance in the body, and when their function declines, fluid tends to accumulate in the lower limbs due to gravity. A simple way to check for edema is the pitting test. Press your finger gently on the swollen area for a few seconds, then release. If a dent remains in the skin and takes a while to return to normal, it suggests fluid retention. Additionally, swollen areas may appear shiny, tight, and may feel heavy or uncomfortable. If accompanied by other symptoms like fatigue, shortness of breath, or reduced urination, the individual should seek medical attention promptly to prevent serious complications. Pain in the feet, when lying down or during the night, can be an alarming sign of a serious condition called critical limb ischemia, a severe stage of peripheral artery disease, PAD. In this condition, the arteries supplying blood to the legs become critically narrowed or blocked, preventing oxygen-rich blood from reaching the tissues of the lower limbs. When lying flat, especially on the back, the effect of gravity decreases, making it even more difficult for blood to flow downward to the feet. As a result, pain, numbness, or a heavy sensation may become more noticeable. A characteristic sign is that the discomfort tends to ease when the person lowers their legs off the bed or sits up, as gravity helps improve blood flow to the feet. However, this position only provides temporary relief and does not address the underlying issue. If left untreated, critical limb ischemia can lead to tissue death, foot ulcers, or even limb amputation. Early vascular examination and circulation assessment are essential to prevent these dangerous complications. Skin on the feet or toes turning dark, gray, or showing signs of tissue death is one of the most severe and urgent warning signs, indicating that the tissue is dying due to a lack of blood and oxygen. This condition, known as gangrene, is often a consequence of advanced peripheral artery disease or poorly controlled diabetes. When blood flow is obstructed for a prolonged period, the tissues in the feet cannot survive and begin to deteriorate. Initially, the skin may change color, become numb, and eventually turn black, dry, and hard with complete loss of sensation. Without immediate medical intervention, bacteria can infect the dead tissue, leading to widespread infection and sepsis, a life-threatening condition. In many cases, the affected person may not feel pain due to prior nerve damage, which delays detection and treatment. Therefore, if you notice that the skin on your feet or toes is turning black, cold, or numb, seek emergency medical care immediately to prevent life-threatening complications. Blood circulation to the lower limbs plays a crucial role in maintaining foot health, especially in older adults, who are more susceptible to issues such as numbness, cold feet, or even foot ulcers due to poor blood flow. In addition to regular physical activity and managing underlying health conditions, incorporating certain foods that support circulation is a simple yet effective strategy. Below are 3 foods that have been scientifically proven to naturally and safely enhance blood flow to the legs. The first is dark chocolate, with at least 70% cocoa content. This type of chocolate is rich in flavanols, a group of plant compounds known to stimulate the production of nitric oxide in the body. Nitric oxide helps relax and dilate blood vessels, thereby improving blood flow to the extremities. According to research, consuming just 28 grams of dark chocolate daily can improve circulation by up to 20% within 2 weeks. It's an ideal option for those looking to boost their health while indulging their sweet tooth. The second group is fatty fish, including salmon, mackerel, and sardines, all known for their high omega-3 fatty acid content. Omega-3s have powerful anti-inflammatory properties and help reduce blood viscosity, making it easier for blood to flow through the small vessels in the lower limbs. Eating fatty fish at least twice a week can enhance peripheral circulation by up to 30%, making it especially beneficial for individuals with vascular disease or diabetes. Lastly, beets, a simple root vegetable with a powerful impact on blood flow, deserve special mention. Beets are rich in nitrates, which are converted into nitric oxide in the body, leading to significant vasodilation. Drinking 240 milliliters, about 8 ounces of beetroot juice daily, has been shown to increase lower limb circulation by approximately 25% within just a few hours of consumption. This makes beet juice a fantastic choice for breakfast or as a midday boost to quickly support vascular health. In summary, taking care of blood circulation in the legs doesn't have to rely entirely on medication. With 3 accessible, easy-to-prepare, and delicious foods, dark chocolate, fatty fish, and beets, older adults can take proactive steps to improve vascular health in the lower limbs. This, in turn, helps reduce the risk of serious complications such as foot ulcers, tissue necrosis, or even limb amputation. Remember, your feet may be small, but the messages they send should never be underestimated. Ignoring them could mean missing the body's earliest warnings of serious health problems. Now, we want to hear from you. Have you noticed any of these signs in your own feet? Did any of these facts surprise you? Share your experiences and thoughts with us in the comments below. We'd love to hear from you. Thank you for watching.